that, I will hand it over to Secretary Smith.
Thank you, Erica. I want to take a few moments and talk about 3 initiatives that I've mentioned previously, but today I wish to address them in more detail. Last week I had mentioned that long-term care facilities, especially skilled nursing facilities where the most vulnerable Vermonters may reside, are challenged by outbreaks in their facilities, especially during the first 24 to 48 hours of an outbreak, when staff may test positive and have to isolate, and other staff who are close contacts to the positive must quarantine. It is also challenging in these facilities when residents are near death and require additional staff attention. This situation produces a scramble to provide adequate staffing, either through heroic efforts of existing staff or equally heroic efforts of volunteers or temporary staff, or through institutions like UVMMC or Home Health, which have been great partners in this effort, or all of the above. But we need to do more. The state of Vermont has contracted with TLC HomeCare, a staffing agency based out of Williston, for emergency long-term care facility staffing needs. This is a professional staffing pool and represents new capacity within our system. It will augment our existing Medical Reserve Corps and serve Vermont volunteer pools. TLC has been an excellent resource for many Vermont facilities in supporting staffing needs throughout the pandemic, and we're confident they will hit the ground running with expanded capacity to meet the increasing need. TLC is a Vermont-owned company operated by nurses who care about fellow Vermonters. TLC will provide for emergency staffing deployment of up to 40 staff total. Those are RNs, LPNs, LNAs, and unlicensed caregivers and support staff specific to long-term care and COVID outbreak response needs. The contract will be managed by DALE, the Department of Aging and Independent Living, as part of the Health Outbreak Prevention and Response Team. That is a rapid response team that's been organized since the start of the pandemic. The contract has flexibility to pivot to different needs. However, the primary focus is providing staffing to long-term care facility outbreaks. This is a solution meant to augment staffing shortfalls which arise in long-term care facilities, particularly, as I said before, when an outbreak situation is identified and staffing is impacted by the virus. It is a short-term and not intended to solve all staffing concerns, yet will meet critical needs to bridge gaps for COVID-19 outbreak situations. In addition, DALE has created a website, covidstaffing.vermont.gov. It's a call to action for Vermonters who have capacity to step up and help meet the critical needs of COVID-19 responses in long-term care facilities. Clinicians with capability to step in are especially needed in either paid or volunteer roles. We are in this together, so we are requesting Vermonters to assist in our healthcare, our healthcare heroes during this surge. The need is great for clinicians and support staff. Just to be clear, the intent is not to shift existing healthcare workforce into this pool, but rather a call out for those that have additional capacity: part-time workers, retirees, unemployed individuals, college students, to step up and fill short-term gaps in the system caused by COVID-19 outbreaks. I want to take a few minutes. I also want to say this. I can't leave the subject without thanking the long-term care facility workforce enough for their dedication and skill in caring for the most vulnerable Vermonters in the most unimaginable of circumstances. They need help, and we need to help them, and help is on the way. Now let me turn to testing. Besides the establishment of greater capacity in our testing statewide, including new sites that will be up and running next week in Richford and Swanton, as well as Wells River. I wanted to talk about more capacity on we're bringing on for surveillance testing. Last week we performed 34,500. The last 7 days we performed 34,541 tests, and we're adding to that capacity because still we are seeing too many days of over 100 COVID-19 cases. So we must do everything that we possibly can to get a handle on the virus and put more safety measures into place. One way to improve is what we know about the spread of the virus, and to address the elevated risk is for more people to be tested. To that end, we're requiring 25% of patient-facing healthcare providers and staff to be tested monthly. As we all appreciate, our healthcare workforce is essential and critical regardless of COVID-19, and even more so during this pandemic. There is no question that healthcare providers and staff can safely deliver care and services in healthcare settings and can prevent the transmission of COVID-19. Personal protection equipment, along with recommended safety precautions, make healthcare settings safe for patients, providers, and staff. However, this is a very large workforce that is also circulating in the community where transmission can more easily take place. So in order to accomplish our goal of more surveillance and to protect this workforce, AHS and the Department of Health have worked to increase testing capacity both by working directly with healthcare providers and through on-demand testing sites. The teams will continue their work to identify and implement the fastest and most efficient testing options available to minimize the burden on the system. And again, I want to take some time to thank the heroic healthcare providers and staff who are on the front lines providing high-quality, compassionate care and support for the people of our state. In addition, starting next week, we are augmenting the approximately 105 full-time equivalent contact tracers we have with a new call center. The call center will be put in place using Maximus staff. Maximus is the current contractor charged with administering the Vermont Health Connect program in terms of having a call center. The Maximus team will begin early next week and will bolster contact tracing efforts by midweek. The initial rollout will include 25 agents, but 2 more waves of 25 people will be added for a total of 75 additional contact tracers. The expanded team will be working 8 a.m. to 4:30 p.m. daily, 7 days a week, including holidays, until we decide they are no longer necessary. Maximus has experience in this work, including statewide tracing efforts in other states. And just one other item, I just wanted, while I'm up here, take the opportunity to say that this is the last week of open enrollment, the yearly period for individuals to sign up for health insurance coverage. That coverage through the Vermont Health Connect. Enrollment opened on November 1st and ends next Tuesday, December 15th. The customer service support hours are extended for the final days of open enrollment to provide personalized assistance for Vermonters. It's important to remember that if you try to get through and aren't able to complete the process by the deadline, we will still be able to help you throughout next week. The COVID-19 public health emergency has shown that having health insurance is as important as ever. The state of Vermont is committed to ensuring that Vermonters have access to health coverage, and those that qualify for financial help will get it help paying for it. Vermonters can apply for health coverage online at vermonthealthconnect.gov and by supportive enrollment assistance offered by telephone, and the number is 1-855 899-9600, and through regional-based assisters. The state also offers a plan comparison tool so Vermonters can get quick, anonymous estimates for financial help and learn about available health care plans. I'll now turn, that's the conclusion of my update. I'll now turn it over to Dr. Levine, who will provide his weekly update as well. Thank you very much.
As you can see, we're now over 5,500 total cases since the pandemic began, and 93 deaths. We're reporting today on our website 113 new cases, and we'll be also showing 26 hospitalizations, 2 patients in the ICU, no patients on ventilators. So we've seen a lot in the national news and gotten questions here about the potential impact of Thanksgiving on cases. It's now been about 2 weeks since Thanksgiving. You can see on this slide the time period where we would begin to see any impact, starting at around 7 days after the holiday. This gives the 7 to 14 day span. We did have that highest case day ever, which was clearly not all related to Thanksgiving by any means. It had a lot to do with reporting and issues, as you recall, with the UVM Medical Center's reporting and other late reports that came in. We have been pretty much in a stable pattern over these number of days. There still may be people who became symptomatic late in their course, maybe days 11